there's this thinking, Stephanie, that people have to have a medical label to make something valid.
Yeah.
It's wrong. So
Yeah.
what we've done is we've said, okay, well, you need to have this label of ADHD or bipolar depression or schizophrenia or clinical anxiety disorder. You needed this clinical medical diagnosis to make it valid. But your story is valid. You do not need a medical diagnosis to make what you're going through valid. What you're experiencing deserves to be honored. What every single person is experiencing every day of their life is we need to be validated. It could be a little argument with a sibling, but that's relevant to you because that may make you feel so bad about yourself that you go to school that day really battling, and therefore it affects how you concentrate at school. And that may not seem huge in the scheme of all the things that can happen, but if that happens persistently and it's not addressed, that child's going to be battling to concentrate, for example, in the classroom environment. So therefore, maybe their grades start going down, or the teacher notices there's a difference in behavior. So
Hmm.
then suddenly the parent is called in saying, hey, listen, your child can't concentrate. Your child has ADHD. Let's go for the diagnosis labeling route. And then that limits the child. Meanwhile, the child's story is being invalidated. A child and an adult, a human, we need to be able to understand what we are going through. We need to be given the tools to be able to process and express and deal with these issues that we're going through. You can't just eliminate them. You can't eliminate anyone's story. What's happening to you and what has happened to you is always going to be there. But how we learn to manage that is going to be linked to our resilience, it's going to be linked to our mental health. And it's an ongoing process because life just keeps happening and good and bad things keep happening.